Congresswoman Nita Lowey, welcome to Washington Journal this morning. Thanks for calling in.
Thank you very much.
Just want to get your thoughts on how your community is doing. We hear so much about New York City in particular. Tell us about it.
Well, as you know, too many neighbors, community leaders have been ill. People have been laid off at unprecedented rates, and I have spent too many hours on the phone trying to access unemployment insurance benefits. Many of our businesses are suffering. My district offices in Westchester and Rockland have received hundreds of calls, emails from constituents who just can't keep their businesses afloat. Others, as I said, trying to get unemployment. Now, I'm proud of what we've done so far in the Congress with 3 bipartisan bills that I, as head of the Appropriations Committee, have helped shepherd through Congress. And this provided trillions of dollars to families, businesses, communities. But we have to do more to protect the lives and livelihoods of the American people. And that's why we are working on a new package that would be $250 billion in assistance to small businesses, $100 billion for hospitals, community health centers, health systems, including production and distribution of national rapid testing. We still don't have that, which infuriates me. $150 billion for state and local governments to manage this crisis. A 15% increase to the maximum SNAP benefit to help families put food on the table. These are common sense policies that everyone, Democrats and Republicans, can get behind. And I hope that Republicans will come to their senses and move this package at once.
Are you surprised?
Be the last word, yes.
Are you surprised at all that you said this won't be the last one? Are you surprised at all how quickly that small business fund seems to be tapped, and in addition needing a replenishing?
Well, I'm not really surprised because I see what's happening in my community, Westchester and Rockland. You know, the stores are closed, everything is locked up, and the lines, the calls, and I'm talking about phone lines, trying to get through to unemployment is what I hear about over and over and over again. And by the way, this last package that we have to pass won't be the last one. We're going to have a serious, long-term conversation about the investments we can make to make sure we revitalize our economy, and things like infrastructure investments to create jobs is so important. Now, in addition to legislation, we also have to ensure that the tax dollars committed to this crisis are spent carefully and well, and I'm pleased that Speaker Pelosi has created what we call a modern-day Truman Commission. This is bipartisan, and it's the House Select Committee on the Coronavirus Crisis. Look, we'll get through this. This is the United States of America, and as a New Yorker, I'm particularly pleased the way Andrew Cuomo is handling this. I hear this from all my constituents. He's giving a report every day that's solid, that's based on facts. So we will get through this, but this is the most difficult time I can remember as a member of Congress.
And we know in the past that you've been instrumental in pandemic preparedness legislation. After all of this is through, looking ahead, what do you think the U.S. needs to do in terms of being more prepared for potential future pandemics?
Oh, boy, that's a good question. It shocks me that the federal government, led by this president, and his remarks where he's arguing on the phone with anybody that asks a thoughtful question, and when he does his press conferences, if he doesn't understand that we are the United States of America and we were not prepared, why should nurses, I hear about this all the time, I see it on the news, especially local news in my local hospital, have to worry about masks, have to worry about all the equipment that they need. They are so brave, the nurses, the doctors that are here going into the hospitals, that are talking to people in the communities, that have set up drive-in places. that we are not prepared. We're still scurrying around looking for equipment. What kind of preparation is this? So, although this president thinks he's the great leader, I would hope everybody, Democrat and Republican, can learn a lesson from the inability of us to really provide what's necessary to our people. I cannot tell you how much time we spend just to go back to the issue of unemployment insurance. People get on the phone and they dial and dial. One person who called me said that she was on the phone for about 8 hours, and they had their 2 kids taking turn, their husband taking turn. They can't get through. This was, I think, improved in New York. I'm not sure about the rest of the country.
One more quick question for you. The House is due back next by schedule next week, the 20th. Your sense? Do you think you'll be back in the nation's capital the week of the 20th?
I certainly do not think so. I don't think it's possible. Look, we're all working. Today I have meetings starting with you, and I'm going all day long here. So we're working. But I'll tell you, I have no interest in going back now. How do you get there? Train, plane? Last time I got there, I drove for about 5 hours, and people across the country are not going to take a chance. So unless it's safe, I think we're better off doing our work as we've been doing, passing bills by unanimous consent, and hopefully there is a bipartisan will to really focus on what we need and leave partisan politics aside.
And the Speaker and Leader Schumer in the Senate releasing a joint statement today calling for the passage of that legislation, that relief legislation. Do you think that will happen in the Senate this week?
I would hope so. Look, this is not a time for partisan politics. The Speaker and certainly our Senator Schumer have really been working together with a focus on what's needed out here. This is not a time for Leader McConnell to say, I don't like this bill, I don't like that bill. We have to work together to help the American people, and then we have to look back after this is over, and I hope it's soon, and see why we weren't prepared, why the President of the United States couldn't marshal all the people, all the equipment to do what is essential. I'm glad that he had the intelligence to have Fauci at his side. I've worked with Dr. Fauci for years, and he understands this inside and out. So we have to put politics aside, do what's necessary, and pass anything that goes through the Senate with unanimous consent in the House, because no one can get back to Washington now.
Representative Nita Lowey of New York. Madam Chair, thank you for joining us this morning.
You're welcome. It's my pleasure, and good luck and stay healthy. Thank you.
Thank you.